Question 4, Professor Chan Wing-kwong. Thank you, President. The provision under the Tobacco Control Legislation Amendment Ordinance 2025, that is the amendment ordinance prohibiting the possession of specified alternative smoking products or ASPs such as e-cigarette capsules and heat sticks in public places took effect on the 30th of April this year. In this connection, will the government inform this council, 1. of the respective numbers of complaints and referrals received, inspections conducted, and ASP seized in the operations, fixed penalty notices issued, and prosecutions instituted by the Tobacco and Alcohol Control Office of the Department of Health for offenses related to the possession of ASPs since the amendment ordinance came into effect. 2. Whether any non-local visitors have been prosecuted or issued fixed penalty notices for breaching the amendment ordinance, if so, of the details. And 3. Whether the authorities have assessed the effectiveness of the amendment ordinance in preventing smoking and encouraging cessation among the public, if so, of the details. If not, whether they will conduct relevant surveys. Secretary for Health. Thank you, President. In consultation with the DH, the reply to the question raised by Professor Chan is as follows. The government has all along advanced tobacco control efforts in a science-based, public opinion-oriented, multi-pronged and incremental manner. As early as in 2016, the World Health Organization (WHO) invites parties to the Framework Convention on Tobacco Control to adopt regulatory measures to ban or restrict the manufacture, import, and distribution, display, sale, or use of e-cigarettes. The government's strategy towards alternative smoking products, ASPs, including e-cigarettes, heated tobacco products, and herbal cigarettes, is to nip the problem in the bud and prevent ASPs from gaining a foothold in Hong Kong, while fundamentally combating the use of ASPs for drug consumption. To this end, the government introduced the Smoking Public Health Amendment Ordinance 2021, which was passed by the LegCo in 2021. One of the measures was to prohibit the import, manufacture, promotion, sale, and possession of ASP for commercial purposes starting from the 30th of April 2022. To further enhance the control on ASPs, the government introduced the Tobacco Control Legislation Amendment Ordinance 2025 and was passed by LegCo in 2025. The amendment ordinance includes a ban of possession of specified ASPs such as e-cigarette capsules and heat sticks in public places. Building on the 4-year-old comprehensive ban on the import and sale of ASPs, the ban on possession in public places prevents the local circulation of ASPs, which are long banned from import and sale, and also protects the youth from nicotine addiction. As the number of smokers of conventional cigarettes drops, the tobacco industry has packaged nicotine addiction products as ASPs and is promoting them to young people and non-smokers in an attempt to expand its market and sustain its profits. These products are deliberately designed to be stylish, compact, and even toy-like, with bright colors and tech-oriented packaging in order to lower the guard of young people and lure them into trying ASPs or even switching to conventional cigarettes. In reality, this is sugar coating. When the coating is peeled away, we discover its true nature, poison. The WHO has clearly stated that there is insufficient evidence to show that heated tobacco products are less harmful than conventional cigarettes, while e-cigarettes release many toxic substances that can cause cancer or damage the nervous and respiratory systems. Even more concerning is that ASPs are highly concealable. They're small in size, produce no naked flame when used, and can be easily tucked away in a pocket after use, making them hardly noticeable to others. This makes them an ideal vehicle for criminals to distribute drugs, and etomidate is the most compelling examples. The use of ASPs does not help reduce the use of traditional cigarettes. Instead, it increases the likelihood that users will use multiple tobacco products in tandem. However, when promoting these aptly named sugar-coated pills, the tobacco industry markets them with selling points such as harm reduction and even smoking cessation aid. If no action is taken to crack down on these products, from sources of supply to distribution and sale, the long-term consequences will be dire. Since the possession ban of ASPs in public places took effect on the 30th of April 2026, TACO has conducted over 4,000 inspections as of the 31st of May. During the same period, 40 Related complaints and referrals were received and 51 FPNs were issued for the said possession offense. None of these cases involved aggravating factors requiring prosecution. Among those who received FPNs, one person did not register with a Hong Kong ID card. Since whether an offender is a tourist and the purpose of their visit to Hong Kong are not factors for consideration during enforcement, TACO does not keep records of the number of tourists among the offenders. TACO also seized a total of 69 ASPs during the operation, of which e-cigarettes accounted for 52%, with the remainder being heat sticks. Moving forward, TACO will continue to strengthen inspections using a risk-based strategy in order to crack down on related illegal acts. Through the implementation of a comprehensive tobacco control strategy, we have achieved tangible results. According to the Thematic Household Survey (THS) on the pattern of smoking conducted by the Census and Statistics Department from July to October 2025, Hong Kong's smoking prevalence dropped to 8.5% in 2025, hitting a historical low. As regards ASPs, following the implementation of the import ban in 2022, among others, the proportion of daily e-cigarette users aged 15 plus dropped by 0.2% in 2023 to 0.1% in 2025, with the absolute number falling from 11,600 to 7,900. The same proportion for heated tobacco products dropped from 0.1% in 2023 to a level beyond accurate estimation. These figures were recorded before the implementation of the possession ban of ASPs, as well as other tobacco control measures under the amendment ordinance, such as the expansion of statutory no-smoking areas, reflecting a growing social shift towards a smoke-free culture. The survey results also show that smoking prevalence among young people remain at an extremely low level, indicating the fact that new generations no longer accept smoking behavior. Adolescence is a critical window for preventing smoking addiction. Research indicates that reducing young people's exposure to e-cigarettes in social settings can help reduce their likelihood of trying e-cigarettes and weaken the misconception that the use of e-cigarettes is normal. The possession ban is a crucial step toward denormalizing ASPs. We'll continue to conduct THS every 2 years, and the impact of the possession ban and the new phase of tobacco control measures on smoking behavior will then be reflected in the next round of THS in 2027. In addition to legislation, the 10 measures for tobacco control announced by the government also include the strengthening of smoking cessation services and publicity and education. The DH has been subventing a number of NGOs to provide free smoking cessation services and educate the public on the harm caused by tobacco, so as to ensure that the message reaches all segments of society. For instance, during the Quit in June campaign, the DH distributed free one-week smoking cessation drug trial packs and Chinese medicine earpoint patches through more than 300 community pharmacies, smoking cessation clinics, DHC Expresses, DH clinics, and designated Chinese medicine clinics. This year, an AI-assisted smoking cessation counseling service was also launched. Following the campaign each year, the number of calls to the smoking cessation hotline has surged, indicating an uptick in smokers' intentions to quit. We will continue to monitor the implementation, and we will make timely adjustments as we move toward the goal of a smoke-free Hong Kong. Professor Chan. Thank you. I'm glad to see the concrete results of tobacco control measures. Smoking prevalence in Hong Kong has hit an all-time low. However, publicity and education matter, especially in the case of ASPs. As the Secretary said, many ASPs are like poison chalice. They look stylish, compact, and this has lowered the guard of young people. Therefore, in this connection, I'd like to ask the administration whether it will continue to work more closely with schools, educational institutions to hammer home the harmful effects of ASPs. We need to let teenagers and members of the public know that the consumption of ASPs might cause cancer. This is not chic. We need to let members of the public know that they need to say no to ASPs. Secretary. Thank you. Definitely, we need to work with the schools. As I said, adolescence is a critical window for preventing smoking addiction from taking hold. Therefore, we need to work with different organizations. We work with COSH to organize a series of events to hammer home the message of promoting a smoke-free Hong Kong. We will also promote to young people that we need to say no to cigarettes. We need to help them understand the detrimental effects of smoking. We need to help young people from cultivating a habit of having a smoke-free life. We also want to train them to be future tobacco control leaders. The DH has plans to work with NGOs on life education schemes. We need to let students know the tactics of advertisers regarding ASPs. We want to prevent nicotine addiction among young people owing to peer pressure. This scheme has benefited over 20,000 students. Dr. Johnny Ng. Thank you. Recently, some buyers on social media sell these illicit ASPs. At the same time, they give up on traditional delivery services in order to circumvent decoy operations. They send these products to convenience stores or other self-pickup stores. I'd like to ask how the administration will clamp down on such legal acts. What plans do you have up your sleeve against these tactics that are ever-changing and evolving? Secretary, the government will take rigorous law enforcement actions. We will also employ a wide range of different measures, be they inspections in physical outlets or cyber patrol. Law enforcement agencies conduct joint operations in order to prosecute offenders. In order to enhance deterrence, we have already stiffened the penalties. But above all, the government needs to promote to the public in relation to the detrimental effects of such products. We need to hammer home the message that the public should not buy these detrimental ASPs. This is a way to reduce the need to buy these products. Regarding cross-boundary logistics and social media platforms, the Customs and Excise Department works very closely with TACO regarding conducting online patrols. In case of any suspicious cases, we request websites or social media platforms to ban such accounts. In 2025, a total of 1,780 advertisements were required to be taken off the shelf. We'll continue to carry out inspections. Thank you. Mr. Tang Fei. Thank you. The Secretary once again said in the main reply that they would take law enforcement actions against possessing ASPs in public places. Now young people no longer smoke conventional cigarettes. They jump on the bandwagon and smoke ASPs. Within campuses, if they smoke ASPs or when they possess such products, schools will handle these matters. However, in public places outside campuses, if TACO or law enforcement agencies catch these young people, will they be penalized in the same way as adults will be? Or will you first practice education before penalizing these students? Thank you. Secretary, Mr. Tang just now asked, when students use ASPs inside campuses or outside campuses, the amendment ordinance took effect on the 30th of April, and possessing such products in public places in Hong Kong is illegal. Hong Kong is a place where we attach a lot of importance to law. We understand very well that we need to educate our younger generations. That is why we take a two-pronged approach. In addition to law enforcement, we also focus on education. We work with COSH, and the DH works with a lot of NGOs. They do their level best to enhance public education efforts. Thank you, Ms. Christine Fong. Thank you, President. There is a study showing that smoking shisha for an hour is equal to smoking of inhaling the smoke 100 to 200 times of a conventional cigarette. Some members of the public smoke fruit-flavored shisha. Some young people may find smoking shisha not harmful. And I realize that the DH has quit in June campaign in June. I'd like to know whether TACO has any actions to regulate the consumption or the inhaling of shisha. And I'd also like to know whether there are any publicity efforts on the harmful effects of shisha. Secretary, regulation over shisha and that over conventional cigarettes are actually the same. There is no exemption regarding shisha. In no-smoking areas such as bars and restaurants, sale or smoking is banned. The smoking of shisha is harmful. There are toxic substances, and it will also emit carbon monoxide. We will carry out regular inspections in a more rigorous manner. We will also issue fixed penalty notices. We'll continue to enhance our regulation and inspections. Thank you. Mr. Chrisip. The Health Bureau has been enhancing its efforts on tobacco control. Smokers are well aware of that. The WHO has given an award to Hong Kong regarding the tobacco control measures. For me, I'm concerned about tobacco control measures regarding teenagers. I've seen from the reply that there is a significant decrease in smoking prevalence among young people in Hong Kong. In 2009, January, for the children born after January 2009 in the UK, they are not allowed to buy cigarettes. I'd like to know if the administration has a similar plan in mind. This is a way to forbid the selling of cigarettes to young people. Secretary. Hong Kong has been adopting a science-based approach regarding the implementation of tobacco control measures. There has been mounting scientific evidence showing the regulation is key, so we will draw reference from the recommendations provided by the WHO. We will also implement tobacco control measures with empirical evidence. The Tobacco Control Legislation Amendment Ordinance 2025 mentions the 10 measures for tobacco control. We will implement these measures in a timely manner. In July 2023, we conducted a public consultation on having a smoke-free Hong Kong. That included secondhand smoke, control measures, impacts on Hong Kong, and restriction of displaying conventional smoking products or banning the sale of cigarettes to people born after a certain date. We have already drawn reference from these public consultation findings. These will be our midterm to long-term measures. However, we need to balance tobacco control measures and the acceptance levels by members of the public. We will consider these medium to long-term measures in a progressive manner before we decide to launch them. Thank you. Reverend Peter Cohen. Thank you, President. The Secretary mentioned an award given by the WHO to Hong Kong. I'm glad to see the recognition Hong Kong has earned. I'd like to know in the past 3 years what the key factors of Hong Kong are in relation to launching tobacco control measures, and I'd also like to know the concrete plans under the 10 measures for tobacco control. Thank you. The current term government has a very clear goal with regard to tobacco control. We need to encourage members of the public not to smoke. We also need to restrict the widespread use of tobacco. We need to minimize the impacts of secondhand smoke on the public. Above all, we need to prevent younger generations from developing nicotine addiction. In 2023 to 24, we increased tobacco duty rate. Afterwards, we have also launched 10 measures for tobacco control. One of the measures included is to enhance efforts on illicit cigarettes. There is a legislative framework, and we have also expanded statutory no-smoking areas. Furthermore, we have also banned the possession of ASPs in public places. We will continue to enhance public education and smoking cessation services. Next year, in December, we will implement measures to standardize the packaging of traditional cigarettes in order to lower the appeal of such products. At the same time, the duty not paid packaging system will also be launched. These two measures will be taken forward in tandem. We will also implement measures to enhance our efforts against flavored traditional cigarettes. Professor Chan. Thank you. I'd like to know if the administration has projected the number of people possessing and smoking ASPs. What are these figures respectively? Does the administration have any timeline in relation to having a blanket ban on smoking and possessing ASPs? Thank you. In our main reply, we have already said the Census and Statistics Department has conducted a THS, that is Thematic Household Survey, for the proportion of daily e-cigarette users aged 15 plus, dropped from 0.2% in 2023 to 0.1% in 2025, with the absolute number falling from 11,600 to 7,900, whereas the figure for heated tobacco products dropped from 0.1% in 2023 to a level beyond accurate estimation. These figures reflect our efforts. Going forward, in the next THS to be conducted, we will take stock of the effectiveness of the measures we take forward this time round. In our legislative exercise, we have already banned the possession of ASPs. Going forward, we'll continue to study our timeline. Thank you.